am Lady Jane B. Patangan, BSCRIM 3D. In this activity, we tackled about analyzing factors affecting polygraph accuracy. We chose case 1, titled A Case Study of a Nervous Suspect with a High Heart Rate Falsely Appears Deceptive. The abstract of this study. This report analyzes a case study involving a nervous suspect whose elevated heart rate during a polygraph examination led to false positive for deception. The report identifies key factors contributing for this inaccuracy, focusing on physiological, psychological state, and examiner competence. Recommendations are provided to improve the reliability of polygraph testing in similar situations. Introduction. Polygraph tests rely on measuring physiological responses to assess truthfulness. However, physiological responses can be influenced by factors unrelated to deceptions, such as anxiety or nervousness. This study examines a case where a nervous suspect's elevated heart rate was misinterpreted as deception. This case study, titled A Nervous Suspect with a High Heart Rate Falsely Appears Deceptive. A polygraph examination was conducted on a suspect who exhibited significant nervousness. Their elevated heart rate throughout the examination was interpreted by the examiner as indicative of deception, despite the suspect's claims of innocence. Subsequent investigation revealed the suspect's nervousness stemmed from the stressful nature of the interrogation process itself, not from guilt. The methods of this case study. First, data collection. Physiological data, the heart rate, the skin conductance, respiration rate were collected using a standard polygraph machine. Second, psychological assessment. A pre-test interview assessed the suspect's baseline anxiety and emotional state. A post-test interview explored the suspect's experience during examination. And the last, examiner review. The examiner's interpretation of the polygraph data was reviewed for potential biases or misinterpretations.
I am Wayne Bigalio. These are the continuation, result, and discussion. First, result. First, psychological response. The suspect heart rate remained consistently elevated throughout the examination, exceeding normal baseline levels. This was initially interpreted as a strong indicator of deception. Second, psychological factors. The pre- and post-test interviews revealed significant anxiety and apprehension on the suspect's part, directly related to the interrogation setting and the seriousness of the accusations. Third, examiner interpretation. The examiner's report highlighted the elevated heart rate as the primary reason of suspecting deception, with least consideration given to the suspect's reported anxiety. Discussion. This case study demonstrates how a suspect nervousness can lead to false positive results in polygraph testing. Elevated heart rate, while a common indicator of deception, can also be accused by other factors. Improved accuracy requires a more nuanced approach, including: first, through pre-test interview to establish baseline psychological response and assess the suspect's psychological state. Second, careful consideration of contextual factors that may influence psychological responses. Third, training examiners to recognize and account for anxiety-related psychological responses. Fourth, utilizing multiple psychological measures and employing more sophisticated analytical techniques.
I am Ellen Grace Paraiso. This is the continuation. Solution. In the solution, we have a 5 solution. First, through pretest procedure. Implement a more thorough pretest interview to establish a baseline for the suspect physiological responses and assess their overall psychological state. This includes using validated anxiety scales to quantifying anxiety levels. Second, control question technique refinement. Utilize a more sophisticated control question techniques to better differentiate between responses to relevant and irrelevant questions. This might involve using more nuanced questions and carefully considering the wording to minimize ambiguity. Third, multimodal physiological measurement. Incorporate additional physiological measures beyond heart rate such as skin conductance, respiration rate, and blood pressure. Analyzing multiple physiological indicators simultaneous can provide a more comprehensive and accurate assessment. Fourth is enhanced examiner training. Provide advanced training to examiners on recognizing and differentiating between anxiety-related physiological responses and those indicative of deception. This training should emphasize the importance of considering contextual factors and individual differences. Fifth, data analysis techniques. Employ advanced statistical techniques and algorithms to analyze the polygraph data, accounting for individual variability and potential confounding factors. This could involve using machine learning models trained on large datasets of polygraph results.
Good afternoon, sir. I am Gently Mercaha, and I am assigned the conclusion. The limitation of traditional polygraphs techniques are evidence is case study. Their solution proposed about focusing on improved retest, a assessment, refined questioning techniques, multimedia psychological measurement, enhanced examine training, and advanced data analysis offer a pathway toward more accurate and resellable polygraph results. However, it is crucial to acknowledge that polygraph testing remaining a complex and considered alongside other terms of evidence.
Good day, sir. I am Carl Steven G. Apog, Biscrim Delta. I am assigned recommendations. Number 1. Invest in further research to develop more accurate and reliable methods for detecting deception, potentially exploring alternative methodologies or incorporating advanced data analysis techniques. Number 2. Establish standardized protocols for conducting polygraph examinations, including pre-test procedures, question design, and data analysis methods. This standardization will ensure consistency and improve the reliability of results across different examiners and settings. Number 3. Develop and implement comprehensive training programs for polygraph examiners that emphasize the importance of considering psychological factors, contextual influence, and advanced data analysis techniques. Number 4. Promote transparency and ethical considerations in the use of polygraph testing, ensuring that suspects are fully informed of the limitations of the technologies and the potential for errors. Results should be interpreted cautiously and used in conjunction with other forms of evidence.